Here are two high-yield USMLE-style questions focused on the HMP shunt pentose phosphate pathway and its rate-limiting enzyme, glucose 6-phosphate dehydrogenase, G6PD. Question 1. G6PD deficiency presentation. A 23-year-old African-American man comes to the clinic with fatigue, dark-colored urine, and scleral icterus after completing a 5-day course of trimethoprim sulfamethoxazole for a urinary tract infection. His hemoglobin is 9.2 grams per deciliter, normal 13.5 to 17.5, and his reticulocyte count is elevated. A peripheral blood smear shows Heinz bodies and bite cells. Which of the following metabolic pathways is most likely impaired in this patient? A. Glycolysis. B. Gluconeogenesis. C. Hexosamine-biosis. D. Pentose phosphate pathway. E. Fatty acid bioxidation. Correct answer D. Pentose phosphate pathway. Explanation. This patient has classic signs of G6PD deficiency, which impairs the HMP shunt PPP and reduces NADPH production, making red blood cells more susceptible to oxidative stress, e.g. sulfa drugs. NADPH is needed to maintain glutathione in its reduced form to protect against reactive oxygen species. Question 2. Enzyme regulation in HMP shunt. A researcher is studying the regulation of the HMP shunt in hepatic cells. In which of the following situations would the activity of glucose 6-phosphate dehydrogenase, G6PD, most likely increase? A. High levels of NADPH. B. High levels of NADP. C. Low levels of glucose 6-phosphate. D. High levels of ATP. E. Presence of insulin resistance. Correct answer B. High levels of G6PD, the rate-limiting enzyme of the HMP shunt, is activated by NADP-Me and inhibited by NADPH. This ensures the pathway only runs when there is a taut need for reducing power, NADPH. For example, during fatty acid synthesis or in the oxidative stress response.